Very good afternoon, everyone. Thank you so much for coming and welcome to today's session of the Sphere India COVID-19 Academy. We are so glad to have you all present here for this urgently convened session, as I'm sure you all have been following the news about the Cyclone Amphan. As you know, the name of our session today is Cyclone Preparedness in the context of COVID-19. You know that we have already been grappling with the COVID-19 situation since March, and now we are preparing for the onset of cyclone, heat wave, drought, and flood season. In this session, the panelists who have gathered here will explore various aspects of preparedness and response to cyclones in the COVID context. To discuss this topic with us today, we have 5 eminent speakers, and let me introduce them to you now. Our first panelist today, who is just about to join, is Mr. K.M. Singh from the Policy Perspectives Foundation. Mr. K.M. Singh, a retired IPS officer, he served in the Intelligence Bureau for 3 decades, then at the Indian High Commission in London, and then as the DG CISF. He was a member of the NDMA from 2005 to 2014, where he raised NDRF from scratch. He's the first recipient of the Subhash Chandra Bose Aapda Prabandhan Puraskar this year in 2020. He's currently the Vice President of PPF. A big thanks to Mr. Singh to agree to join us today. Our second panelist today is Ms. Abha Mishra, who is the State Head of UNDP in Odisha. Ms. Mishra has an MSc in Development Anthropology with 28 years of action-based research and implementation experience in community development projects like forest management, disaster risk reduction, livelihood, social protection, and tribal studies. Her specialized skills lie in project management, conceptualizing, designing, implementation, and technical support for programs. Thank you, Ms. Mishra, for giving us your time. She's actually in Puri right now, so we hope that your network holds for the duration of this session.
Yeah, thank you so much.
Thank you, Ms. Mishra.
Good morning, everyone.
Let me introduce our third panelist today, is Mr. Himadri Maitra. Mr. Maitra retired as the District Disaster Management Officer after having spent 32 years in the field. He has written extensively on good practices in disaster governance and also on disaster governance in West Bengal. He's currently a visiting lecturer at the Administrative Training Institute of the Government of West Bengal. Thank you also to Mr. Mitra for agreeing to speak this morning with us. We also hope that your network is good for the duration of this session.
Thank you, and good morning to all.
Our fourth panelist today is Dr. Vivek Virendra Singh from UNICEF. Dr. Vivek has 20 years of global experience working with public health departments, academia, the WHO for polio eradication, and with UNICEF. He has worked in public health emergencies and in strengthening early warning and response systems globally. And he was also the emergency focal point for Odisha UNICEF office during Cyclone Fani. Thank you, Dr. Vivek, for coming back on the Academy platform and to share your expertise with us. We appreciate it.
Thank you, Asta. Good afternoon, everyone.
And let me also introduce our fifth panelist today is Mr. Alok Kumar Ghosh, who is the IAG convener in West Bengal. Mr. Ghosh has 34 years of experience in the field of development and disaster preparedness with CASA, which is the Churches Auxiliary for Social Action. He's the convener of the IAG West Bengal since 2015. And Mr. Ghosh is an expert on community-based disaster management and preparedness and participatory planning on disaster risk reduction. Thank you for being here with us this morning, Mr. Ghosh. We understand that this must be quite a busy time over there, so we really appreciate you being here. Let me now introduce our moderator for this session, who is none other than Mr. Vikrant Mahajan from Sphere India. Mr. Mahajan has 24 years of professional experience working at interagency policy level and frontline humanitarian action with the government, the UN, other corporations, CSOs, and the armed forces in diverse contexts. He has led interagency coordination for more than 100 disasters, and he represents on governance and policy level committees of several international organizations. He currently works as the CEO of Sphere India. Thank you very much, Vikrant, for agreeing to moderate this session. With that, I conclude my introductions, and I'll now hand over the virtual mic to Vikrant to take the session forward. Thank you very much.
Thank you so much, Asta. And a very good afternoon to all of you. I think it's a time when we are facing the latest thing about the cyclone Amphan. It's just 177 kilometer south-southwest east of Dega now. And it says that the cyclone is likely to retain its intensity for another day till tomorrow evening. And it will have some maybe a more deeper impact, not only in West Bengal, Bangladesh, but also the states of Assam, Sikkim. Probably the rainfalls will see the surge in the of water levels in the rivers, and probably some flooding is anticipated. All this is in the context of, we were already grappling with the issues which due to COVID, and that is presenting a more complicated situation in front of us. But uh, in spite of all this, there appears to be a very high level of alert and preparedness among the government and non-government and all actors. And to discuss that and what best we can do is in such situation, and it's just beginning of the cyclone season, and how good and how better we could be prepared for cyclone situations in the COVID context. We have got some very experienced and a very eminent panel today with us. Asta is already introduced. So I think I'll just go. This discussion is going to be in the form of various questions, and with the panelists, a few volley of questions, and then maybe we have few questions from the participants also. They can put the question in the chat box while my colleague Asta will compile that. I'll begin with my first question. I think close to the cyclone is our colleagues from West Bengal, Mr. Alok Ghosh and Mr. Himadri Mitra. So Alok ji and Himadri ji, how is West Bengal? I would say government, CSOs, IAG prepared for Amphan. And what has been different as preparedness in this COVID context? Please help us through this. Over to you, Mr. Alok.
Hello, this time the main problem is with COVID. Government is preparing for this also. For COVID-19, there is control room everywhere in each and every block. So we just, this government just make it possible for 24/7 control rooms to convert it into disaster management control room also. There is no problem in doing so, because there is the setup is up to block level. Disaster management civil defense setup is up to block level, and in each level there is one disaster management officer. So they are already taken the charge of disaster management control room. In West Bengal, we have government have already evacuated almost 3 lakh people from Sundarban area. In other areas also, from kacha houses, people are requested to leave these houses to nearest pakka house or school building. The problem is with social distancing, but every chance is has been taken to make it sure that the evacuated people maintain this social distancing. They are using mask, and for that reason, more school building has been taken for flood shelter in Sundarban areas for maintaining the social distancing.
Right, and, sir. Thank you. So I understand. So there is more social distancing. So we have more number of schools and probably the other shelters, and the mask and other measures are being adapted. Lokda, you can also help tell us like how the preparedness with the NGOs and the IAG over there. Over to you, Mr. Logosh. Maybe you to unmute yourself. Lokda, you to unmute yourself.
Now it is okay?
Yeah, it's okay now. Yes.
So As you know, we are also running with the COVID-19 program. So since 13th of March 2020, the IIG West Bengal have started orientation to its the IIG volunteers to COVID-19 Academy and so on. So, and you have noticed the most of the participants in COVID-19 Academy as of now, uh, it is the highest in West Bengal. So that means West Bengal people have been oriented to COVID-19 Academy. So it is one of the strains to combat the AMPEN program, how we are taking the COVID-19 protocols into the rescue shelters and all this. Another things it is roughly estimated that due to uh, pain, almost approximate 5.02 crore people will be affected. And for that, Himadrida says the government has given an order that one third of the, suppose one shelter is capacity of accommodate 300 people. In that case, the Ampen case, so only 100 people can be sheltered in that. That means 30% of the space to be used by uh, the people. So another, so through this, the automatically social physical distance need to be maintained, and for that 41,872 schools have been identified among five districts. So this is the thing. Another thing, the district IIG is closely uh, contact with last 4 days. We are contacting the district IIG, and district IIG is also contacted with the DDMO, then BDMO, and up to the panchayat level. So all the volunteers, it is almost 12,000 the volunteers, and some of the volunteers the government has taken as the Abda. So now after giving training, so they now they are appointed as Apta Mitra. So all these Apta Mitra and the volunteers, so they are in place uh, to maintain the COVID-19 protocol as well as to management of the shelter, management of the relief, uh, the relief and the water, all these things need to be, they are preparing all these things. Another thing, the IIG did it. So we have given training to the fourth line worker, like the Anganwadi worker, and Himadrida has also given the training to the ASA worker. So all this initiative was given after the COVID-19, and now this is the time for the action. After giving training, this is the time for action. How we are using this our capacity to in the
Thank you so much, Alokda.
yeah.
So I understand probably similar kind of measures would have also been there in Odisha. Odisha, we've seen some massive evacuations for Cyclone Fani and also Cyclone Falin. More than 1 million people were evacuated, and that became possible because of the years of work on cyclone preparedness with cyclone shelters all across the coast, who were housing the vulnerable population during cyclone time. So, Abha, ji, so how do you see, now in the COVID context, if we have to do such massive evacuations, do we have adequate number of shelters? What additional or different things would be required to be done in Odisha? Over to you, Ms. Abha Mishra.
Thanks, Vikrant. In this COVID situation, and you rightly pointed out that Odisha has had a good experience of evacuating people. As of the press release in the morning today, about 8 a.m., we have evacuated 137,000 people already from the 12 likely districts which are going to be impacted partially or on a heavy eventuality. But there have been a lot of already a lot of damage specifically to the power sector, for which they have already taken lessons from Fani and pre-positioned it. And in the COVID context, some of the COVID centers, which, because Odisha has also taken this one step forward of having COVID quarantine centers or temporary medical camps in each of the GPs. So in the 3-kilometer radius of the specifically for the 5 district like Baleshwar, Jagat Singhpur, Kendrapada, Mayurbhanj, they have also been shifted to a little more safer places. Evacuation has been done. Social distancing is being maintained, but a couple of photographs what we have seen, we see that it needs to be further improved upon, specifically because masks are not available with all the people, so they're using whatever, and sometimes they are not using it. That's one thing. But to combat any other situation, there are temporary mobile teams, medical teams which have been set up, and they're also monitoring it. And any migrants who are coming, if they are negative, they are being home quarantined. They're not being kept into the COVID camps or also allowed in these shelters, but special measures are being taken for it. So I think that's as of now we can take it as the downfall is likely to happen in an hour or two. So we will see how it goes by. But the measures are there. There are already 4 senior IS officers and 4 IPS officers also placed specifically to monitor the situations in these 4-5 major districts, which are likely to be more impacted than the rest of the districts in the state.
Well, that's great. Good to see, the proactive preparedness efforts. And I think we, with Dr. Vivek Singh, we have with us. Vivek ji has been the emergency focal point in Odisha during the Cyclone, and now I think he's again the focal point for the COVID preparedness at the national level. So Vivek, Dr. Vivek, how do you see now this thing? I think the preparedness for cyclones, not just Odisha, maybe across the coast, and not just Amphan, but the season has just begun. So how do you see this thing from both the medical and emergency preparedness point of view? Over to you, Dr. Vivek.
Thank you, Vikrant, for this very pertinent question. Am I audible?
Yeah.
Yes, sir, very clear.
So I think 2 or 3 important points which this cyclone, and again, if I see this is also not a very typical time, one of the slight summer cyclones happening. And first of all, best wishes to all the people on the ground in these 2 states. But as Vikrant rightly said, that what we need to focus on at this stage is the fact, we'll come back to these specific states, but the fact that, these multiple hazards, the multiple hazards were always going to be a challenge with COVID. And the best thing is that NDMA is part of this COVID response. And I heard the mention of Apata Mits, how they have also been trained in management of COVID. So that should come handy. So regardless of this cyclone, I think one approach, and that is where, as UNICEF and other partners, including Sphere Coalition of CSOs, we have been impressing upon the NDMA that overlaying the hazards map across India. Flood season will come. We know the heat waves will follow after the cyclone. That is quite known in the climate. So all this, and how this with the superimposed COVID situation can be catastrophic for these, especially the most marginalized and vulnerable groups. So this cyclone has raised a very important point for CSOs, the civil society organizations across India, that please map the routinely vulnerable districts with other type of natural or man-made hazards, because the COVID situation is now pandemic, and we know across the country, and other natural hazards like this cyclone will keep happening. So that's a very important point. Second thing is, having said, I heard Abha that how many camps have been created in the two states. So there are still some basic steps that can be taken, which can be reiterated with people. I read the numbers, at least for Odisha, 1,600 odd camps, about 1 million people. So basic, again, preventive measures for COVID need to be reiterated. Because we need to understand that most of the people in these camps are already vulnerable population groups, marginalized. So there, this is very important. And some experience from Cyclone Fani. So I'll take just one experience where a system issue can also lead to certain societal issues, leading to lack of access to essential services for vulnerable groups. So we went into a camp, a shelter in one of the districts in Odisha, and what we realized that out of 200 people, there was food sufficiently cooked that day for only 150. So obviously the 50 that were left out were from the socio-economically, I would not say socio-economically backward, but there were some issues of the caste. So then, that's how people realized that if system ensures that 200 people, all food was available, then those 50 that were left out may not have been from the lower caste. So these kind of issues, even in COVID, will not go. So what we need to focus on is the pregnant women, the children, the elderly, and elderly especially with regards to COVID, because we know they are at greater risk. So especially, I don't know what would be the impact of this cyclone, but looking at how long people will stay in these camps, we need to focus on these vulnerable groups. Pregnant women, children, and elderly, I'm again reiterating, and those who have other comorbid conditions, especially diabetes, hypertension, and other diseases. So please focus on them through your CSO workforce on the ground. And as I said,
Vivek,
focusing on these natural hazards.
If I may intervene a bit, like, how do you see that the space and WASH or maybe health indicators to be adapted for the COVID context from the previous experiences?
Very valid point. So see, India is also up in the COVID response. Currently, the government has issued a lot of guidelines on high density populations, and that is what we mean as the slums. If you look at 60 to 70% of the cases across the country currently are in urban pockets where high density slum areas, and there are similar challenges as you would see when you put people in camps. So the same measure should apply. One is that if at all, so the distancing has to be, we know that what's the limitation of distancing. So in such case, you would definitely want to delineate that people who are at risk, they may be separated slightly from the others within the given space constraints, and at least usage of mask. And I see that Orissa has done very well, and of course also West Bengal, in terms of SHGs who were also able to produce and supply masks. Everybody definitely should have masks. And with all the agencies on the ground, as much as possible soap and water that can be readily available for washing hands, because the only constraint that will always be there will be the physical distancing part. So within the given situation, whatever physical distancing we can ensure, but the other two things of washing hands as much as possible, making water and soap available, the cough etiquettes, everybody should have masks, and trying to segregate the people at high risk groups, especially.
Right, sir. Thank you, sir. So today, like one of the important thing we have seen during the cyclone evacuations and other disasters is the role of the institution of an NDRF, which is emerging. And NDRF has played some exemplary role in most of disasters. Today we have with us Mr. KM Singh, who has been instrumental in setting up the NDRF from the scratch. Sir, Mr. KM Singh, I will like to ask you that what will be your advice, and what do you think the NDRF should be doing differently for cyclone preparedness and response in this COVID context? Over to you, Mr. KM Singh, sir. So you have to unmute yourself. So you are mute, probably you have to unmute yourself.
Yeah, I have done that. Can you
Yes.
hear me? Yeah,
We can hear you now, sir. Yeah.
yeah. Thank you. Primarily, as per the Act, NDRF is mandated only for response. But right from the beginning, NDRF has been doing capacity building, awareness generation for preparedness and response in a big way. And that they will continue to do. Now, in the change situation today, because so far, whatever preparedness training they have been given, that was only single disaster centric. But today the situation has changed, where amidst COVID-19, how do we go ahead? Now, NDRF has been doing this program of preparedness in two ways. One is the capacity building of stakeholders like SDRF, civil defense, and they should be doing for the CSO also. But other is awareness generation for the community. And with those, in those both, they have to now train in the different way, prepare for preparedness in a different way, taking into account that COVID is going to stay. And so, what lot has been said already about the protocol, COVID-19 protocol or shelter management protocol. What NDRF can do beyond that is introduce technology in this measure, in their capacity building awareness generous program, because we have to live with COVID-19. And so technology becomes very important. Now, that can be in two ways. One is the individual protection technology, other is the community protection technology, that is shelter management also. In the individual protection, we all know very well that we should have PPE, we should have a face mask, hand wash and all that. But beyond that, now in this situation, because these people who are actually operating the SDRF and all, they are high risk. So face shield is also a must. Everyone must have. But more important is the community preparedness, awareness generation, shelter management. Now there, I would like to mention there are lot of technology which has come now, which NDRF is aware, and they should educate the stakeholders on that. Like for example, there is one infrared thermometer. Now this is fixed on wall, and people cross, and automatically it takes the temperature and photograph both, which is passed on Google or cloud or your laptop. It becomes a permanent record. So it is a very important equipment for the shelters. Similarly, we have the mobile portable blood testing with solar panel. Now this is a very good equipment, and it is appropriate for the relief centers because it is satellite control. It is a very rugged equipment. It tests from remote control, and real-time diagnostic results come, and it can be on real-time basis passed on to the doctor, and it becomes a permanent record of who is there in the shelter and what his problems are. Then for the shelters, for a 500 square feet, there is what is called room air cleaner, which is put on the ceiling, and it can disinfect the entire shelter against virus, bacteria, fungal, etc. There is also equipment which is called ambulance during transit. That is when the people, SDRF people and all go, it can be put in the car or a small space. It again disinfects the small area from fungus, bacteria, and viruses. So these are some of the new technology. So people know, but NDRF in their preparedness measure, they can be used by the state governments, etc., to educate people about these new technology, which I think we should gradually adopt. Thank you.
Thank you so much, sir. So more use of technology, and I think maybe some adaptation of some of the drills also in terms of rescue and equipment will be, I think, and NDRF will continue to be the pillar of work during this search and rescue and early response. Uh, what we have seen is, that the success story has been in the cyclones and floods with the search and rescue, and definitely I think and NDRF being certainly one of the institutions in this added strength. But beyond this, what we see, the response which comes later for livelihoods and economic recovery, I think it has not been that great a journey. I think we are a mix of lessons learned, but are always remaining a lot more to be done in the paucity of resources. Uh, so in this COVID context, perhaps we will be needing more resources for this. So my question will be, I think, to Ms. Abha Mishra. Uh, how do you think we can optimize on resources for preparedness and some advanced planning? For the cyclones and other disasters in the COVID context. Over to you, Ms. Abha Mishra.
Thank you, Vikrant. Mr. Singh has really mentioned quite a good number of technologies, and it is available across the sectors. And secondly, there are a lot of centrally sponsored schemes as well as state sponsored schemes, which could be looked into the context with the lens of the hazards which are there. Now, just for the sake of clarity, if I say if we have a rural housing project going on, it be it the central or the state, when we are budgeting for it, we need to budget it in such a way that all the coastal area uh, arrangement, and specifically the budget, is very different from what you have for the hilly area of the state. Or you have let's say in a Rajasthan type of an environment, arid environment. So the budget cannot be pan India, pan districts. Somewhere we are missing that link. If we are able to take care of that, our assets will get saved. And secondly, some of these schemes from the very beginning, like we know this is a cyclonic season or it is a flooding season, what type of MG Narega works can be done, and it is when you are planning for it, you identify and keep it ready as a bouquet of work to be done, which can be immediately made available to the job seekers. Somewhere that planning component is missing. While we want to reach out immediately to everyone, we make it a pan India or a pan state activity. That's where somewhere the missing link is, and we need to be very work with it to create livelihood and safe assets.
Yeah, I think a great suggestion. I think it's more about, we see our existing resources being invested and how we make it more context specific and optimize it, and also add maybe more feature of risk reduction in that. But do you think also we need to see them from the COVID context now? Because I think the reality is that we're going to stay with COVID for a long time. So say for example of a housing, we need to look at the housing indicator differently now in terms of space.
Yes, it will of course be there, but again, a government cannot give as per the requirement of an individual. So while the government provides a fixed amount for asset creation, it could also bring in instruments which would help the beneficiary to avail that instrument to make a bigger space.
Yeah,
that is where the designing of the project, as well as the awareness which goes looking at all these stakeholders together, needs to go into picture. So that space, why we say, we have the Swachh Bharat Abhiyan and we have the housing. Now, when people realize that these two should be going together, so all the housing beneficiaries are being, encouraged to avail the IIHL work, and then it is a house completed. So in the similar way, we need to bring that synergy between different sectors, as well also come up with more new guidelines and instrument. Maybe somebody can easily take a soft loan, which may be a little lesser, which may not be the market loan structure. And people like we go to the World Bank because their loan for the country it may be very, very low. Or if we want to pick up from the market, it is a higher loan. So
Yeah.
it will begin. So those type of soft loans, grants, everything will have to be mixed. And that is where the planning exercise needs to be done.
Yes, so more interdepartmental or more intersectoral coordination and services will help us achieve that. I think I'll come to you to later, how to do that exactly. But I think Dr. Vivek, maybe you can help us see through this, that how we can have a more intersectoral coordination between health and WASH, specifically looking at now the COVID context and the cyclones and hazards like cyclones and now for which we are preparing. Over to you, Dr. Vivek.
Uh, Vikrant, before I come to this very pertinent question, just a quick reflection on what Singh sir had mentioned. So NDRF, for the knowledge of all the participants today, has also trained in its entire workforce on COVID-19 with structured modules. And as Singh sir rightly said, some of the instruments are also now available, technology instruments which can be used in shelter settings. But the most important point what he raised is that the complacency, when you are faced with a natural hazard like this, people can become complacent ki aaj cyclone aa raha hai, kal ye kya COVID kya nahi, and this can definitely be risky. So the importance of risk communication, as he highlighted, is something where CSOs should continue focusing every day with people in these camps. Now, coming to this question, see, COVID-19 has again raised a very important part of the public health overall, which is water and sanitation. Imagine every celebrity today has made a video on hand washing, starting from the Director General of WHO to you name a celebrity today, local or international, has the first thing that we saw was people doing hand washing videos,
Yes.
and which is very good for public health. So what we need to do in future, and this is very important, most of the, if you look at otherwise also natural hazards, when people come in shelters, the maximum risk is from communicable diseases. And with regards to climate change, one another, after the immediate epidemic response is over, people will also have to think of water availability and resilient response, keeping in mind the climate change and availability of water also, and how we can make sure. But now coming to the WASH and health congregation and collaboration this time, if you see across the globe, infection prevention and control, right from the community level, how communities understand it, how families understand it, to outreach settings, to healthcare facilities, is the most important thrust of the health response globally currently. And I think we should continue this, especially with regards to disaster management, this working together of health and WASH. And now, if you see within the, at least the partners that are supporting the governments, not just in India, across the world, health and WASH are now almost integrated. They are working together for infection prevention and control from community to the facility level.
Yeah, great. Maybe Mr. Alok Ghosh, you can also tell us, like, same thing. We are always short of resources, and now COVID realities say that we need to do more, and we still already have a shortage of resources, and there is also economic slowdown. So how do we can optimize through various CSO coordination and other efforts? Mr. Alok Ghosh.
Yes, I'm audible, right?
Yes, sir.
Yeah. So you are right. It is true that there is a shortage of resources. But if you see, like the COVID-19 academy has started after the COVID, okay? And almost more than 50,000 people were trained on different subjects. How much money we have spent for this?
Yeah, very good. I think we really optimized a lot.
Yeah. So you see, spending very minimum amount of money and reaching out maximum numbers of people, isn't it? So this is one of the avenue which is open for everybody. So we can use the digital, we can use the virtual, the trainings and the software part, and so that through this we can reach out to the maximum end. uh, and for that, I don't think the huge money is required. If we and she also have that much of money to uh, uh,
I'm
spend
getting.
from their side.
Mr. Singh also said about using more technologies, and I think is, yeah, we see most of our CSOs and NGOs and others have that technical edge. Mr. Hamedri Mitra, how do you see that, we can optimize these technologies or through other ways at the community level, since you have a long experience of working at district and closer to communities? Over to you, Mr. Hamedri Mitra.
Actually, we impart training up to the panchayat level when I was in service, up to the panchayat level, which is now also continuing. The our said one important thing: the inter-sectoral coordination. WASH or these are actually disaster risk reduction process. So at field level, we have to think that when WASH and other program is running, it must be integrated with disaster risk reduction process. And we try to give this concept to field level with IIG and all field officers, but it is very important that this concept that social development is actually a disaster risk reduction process, we must admit that at top bottom. This is the main problem.
Yeah,
that
I understand.
we look
We are losing Mr. Mitra, but I do understand your point that more integration of the development programs and the for DRR and others is a way. But I'm still a bit speculative about the digital media and other reach. Though there is a increased penetration of mobile telephony with the communities, but how do we maintain that last mile connectivity and that human to human touch contact, which is so vital for our the way we have done our development programming so far. That will remain one of the challenge. Uh, I think maybe Abba, you can help us think through that also. But my question now would be more coming up, since you said that we can optimize with more service linkages. So how can we have a better interdepartmental coordination? I think one of the learning from all the past disasters, including some of cyclone responses, that we need more coordination. We need more government coordination. We need more government NGO coordination, and then coordination with other stakeholders. But if I just focus on more of an interdepartmental coordination, how can we have do it better and optimize through that, and also perhaps reach out better in a more effective way to communities in the COVID reality? Over to you, Abba.
Thanks, Vikrant. The first and foremost thing, looking at how we are trying to do in many of these sectors in Odisha, the first and foremost is we need to have very, very clear evidence-based, documents which would convince the government at first to start interlinking. Second, is that once we have then we need to bring these two agencies together to show how they benefit from each other. Many a times as individuals we want these successes to be ours, so that is one of the reasons why there are many a times there's no linkages. The third thing which we need to do is create a lot of awareness amongst it at the local level through the local agencies. It can be the government people, we should, and as well as the civil society organization, because I am seeing wherever the civil society is very well integrated within the and understood by the local Anganwadi workers or the panchayat people or the other officials, you would find the integration is being done better. So you would see these islands of things. So somewhere we really need to start working on these things, and we need to have an evidence based, because in 2014, I'll just give you an example from our UNDP context. We were having a disaster risk reduction project in Orissa. And from the Delhi side, when I was in Delhi, so what we started doing was we started talking to the Panchayati, OSDMA along with UNDP started to talk with the Panchayati Raj department why it is important we should have a disaster resilient or a vulnerability mapping before we start a new house, at least to understand. So if you look at the Biju Pakka Ghar guidelines, we have a context where people can use MG Narega work also to raise the prince level, or they could also take up some more activities, which is individual based activity, which will help them in making their house more safer. But that was a dialogue which OSDM initiated with the Panchayati Raj, brought about a little note within the guidance note of the Biju Pakka Ghar. So that is how we will have to work on it. And I know it takes time, but these opportunities, these small opportunities is very important. The only reason why we were able to get that housing guideline, this in a little bit vulnerability indexing within the housing guideline was because of the Phylline cyclone.
Yeah.
So it was after the Phylline cyclone, we talked to the minister, we talked to the secretary, and the OSDMA started pushing. And now OSDMA, since last Feni cyclone, is thinking about coming in with a housing policy which would take care of these factors, which we as disaster management practitioners have been talking about. So like I was seeing a video in the morning, we had COVID, which has reduced the collection of NTFPs, that is non-timber forest produce, which is in a way reducing the livelihood of the tribals. Now with the cyclones in the same areas, they will have a loss because whatever they had collected, it's either not properly dried, it has not been collected from the field where it is drying. So they again have a loss with whatever little they had. So how do we integrate that? We'll now have to start thinking about in these small terms and start talking with the SC and ST department. The technical expertise has to be given from the OSDMA.
OSDM. Yeah, I think the
NGOs will play a very, very role, because NGOs are the ones who are collecting the evidence, placing it before the OSDMA and the SC and ST department.
Yes, I think very important point, Abha, I think is you mentioned about is that collection of evidence, and then evidence leading to both the changes at the institutional level, interdepartmental coordination level, and probably the policy level, to which we'll go to Mr. KM Singh later on. But I think it's now there's also the importance of a very good practice, a good practice available locally in the national or the global context. And one such good practice we see in the global context is about civil military coordination during emergencies. In India, we have seen the rise of NDRF. Again, Mr. KM Singh has been instrumental behind that. And we also have a very strong civil society organization presence. While we have seen this time during COVID, also the government is warming up to the collaboration with the CSOs. Where do we see that, more coordination can be achieved between the NDRF and the CSOs? So, sir, can you guide us that how we can have a better CSO NDRF coordination both for preparedness and response? Over to you, Mr. KM Singh.
Thank you. It's a very relevant question, and one area which has remained unattended so far. There are certain issues. NDRF will be very happy for such coordination with credible NGOs, because NGOs are in very large number. So what will be required is two things for this. One is that for coordination, identification of the credible NGOs. And secondly, some intermediary agency to put NDRF and the CSOs in touch. Now it can be done at two levels. At the state level, the state government will be able to identify which are the credible NGOs in the state. And then this developing linkages between NDRF and the CSOs, identified CSOs, can be done by the SDMA or the disaster management division of the state government, or even by the district magistrate. And if they take the initiative, putting NDRF and the credible NGO CSO in touch, NDRF will be very happy for the simple reason that these trained volunteers of the CSO, that CSO becomes a force multiplier for NDRF. They'll be very happy. And second is at the national level. At the national level, again, identification of credible NGO, like you have a Spare India, it's a highly credible CSO. So that can be done again, either by the NDMA or by the MHA. If they identify and put NDRF in touch with that CSOs for effective coordination, it can work very well. So, but this is very important. Credible NGO, CSO, and intermediary. Here, before I conclude, I would like to mention one point which I missed earlier. There is a latest very good technology, and that is called mobile portable blood testing equipment. It is satellite controlled, and it works on can be remote controlled, and it takes real-time temperature and photograph everything of the person, and through satellite it transmits to the control center. It can be real-time basis sent to a doctor. So in the relief centers, in the real-time basis, you can identify, do the diagnostic test and all that, and carry forward. Thank you. But first question I have answered about the coordination.
Yeah, thank you so much, sir. I think you have really put some of the action points ahead. That we put up these the group of credible NGOs. I think we have come together. Such state interagency groups are existing there, and also at the national level, Sphere Coalition exists as intermediary to work with the NDRF. I think we will take forward some of these actions, and we will see how we can be better prepared for cyclone and other disasters this season. Vivek, sir, I think you have a rich experience not only in India but in other contexts. But coming from the learning from India itself, what are some of other good practices, in coordination, interdepartmental coordination, or this inter-stakeholder coordination, through which we can optimize resources in this reality like COVID, when we are preparing for cyclones or other hazards? Over to you, Vivek, sir.
Vikrant, I think this is a very pertinent question, and just alluding to what Singh sir also mentioned. See, there has to be a mechanism where for any such natural disaster or man-made disaster of the scale that we are talking of, and especially COVID bringing it to the forefront, there are 4 groups when we look at the society which are very much important to be together. So first is the state. I would call it the administration to make it an easy acronym. State as in the Sarkar, so administration. B is businesses. Look at how globally philanthropy, individual philanthropists like Gates control 60% of the budget to some of the international agencies today. So businesses through their CSR, C is the civil society, and D is the development partners, as in the UN and other partners, which have their own mandate on international diplomacy. So these four need to come together for any response. And I would refer to the current global UN COVID response plan, where it clearly mentions even the NGOs are part of this plan. So including the funds, including what actions they will take, in collaboration, in close collaboration with the UN agencies. So that's the kind of integration that is already there on paper in principle globally. Now, how we put this into practice is where state specific, country specific examples need to come in. And I would again say that this NDMA's role, especially for this COVID response, and with the kind of capacity building initiative where Sphere has started with NDMA support, the COVID Academy, and bringing together all the CSOs in some of the most important challenges that we are facing, even for the COVID response. For example, the issue of the migrants, the issue of the urban high dense areas, the slums. So how the civil society, development partners, the government, state and union, and the businesses are coming together for COVID, we must document this and see how we have been able to use this as an opportunity. So, you know, world will, every 100 years, this kind of scale of pandemic comes. But what we should make sure is what we learn out of this. And nothing has stopped the vision that this is supposed to be the decade of action for reaching the sustainable development goals. And we must document how the coming together of these four entities is important for anything where whole of society response is required. And nothing more than COVID has shown us that we need solidarity. We need volunteerism from individuals. So one of our colleagues said we don't need much money. What we need is that every individual comes up as a volunteer, recognizes that they need to take care of themselves and a few others around them for the society to flourish. And this whole of society response should be documented as much as possible. Finally, what I want to say is, again, that let us make sure that we overlay the natural hazards and man-made hazards map of India and see how we have performed as these four entities coming together for COVID response, and document this and continue to use this.
Yes, sir. Thank you so much. I think the importance of a whole of society approach, especially the COVID, has made it a reality and made a necessity for all of us. And we see the way government have opened up to CSO collaboration, the Niti Aayog and other institutions have also come forward. Today, in fact, I'm joining this meeting right from the NDMA coordination meeting with the CSOs. So as you say, we learn from it, we document it, but I think maybe more than learning and documentation, you know, is institutionalizing it probably. And we have with Mr. Singh, who's also been the member of the NDMA. And presently also he is heading, being the vice president of the Policy Perspective Foundation. And sir, I also remember during sir's time, you know, NDMA has worked on the policy guidelines on community-based disaster risk reduction, on the role of NGOs in disaster management, but some of them has yet to see into the public domain. So, sir, from the current experience, you know, and your work at the policy level with Policy Perspective Foundation, how can we institutionalize this, the call for collaboration between civil society and government, and the whole of a society approach, which we are learning in this COVID context? How we can institutionalize this, sir? Can you please guide us, and maybe we will work forward with you on this? Over to you, sir.
Well, I can talk only on behalf of the Policy Perspective Foundation, with which I am associated for the last 5 years. And here in this PPF, we work on various national issues, and we deliberate on the various, to understand better the policy issues and in the national interest, which include disaster management also. In PPF, we have 7 different centers, and there's one center for disaster management and capacity building. And this Center for Disaster Management and Capacity Building in PPF We are very happy to partnership or joint collaboration with the civil society organization. And you are aware, in the month of February, on 28th February, we had a national workshop on highway accidents and emergency medical management, because COVID, a lot of people are dying, but the issue was that in the road accidents every year, 150,000 people die, and there is no emergency medical management system. And there, of course, Minister of Road Transport and Health were involved, but we did the partnership with Aspire India, and I'm grateful for Aspire India. Your contribution was great. And so we do like to have such partnership. In fact, I would like to mention one point for all the disaster management fraternity people to think about it. We talk so much about, but the Act, there's a major gap. The Act talks about human being and property. It doesn't talk about animals at all. Neither in the definition, veterinary department, veterinary dogs are nowhere, animal husbandry is nowhere in that Act. Now, management of animal emergencies, animal in disaster is very, very important thing. As for NDMA, 1 lakh animals perish in flood alone every year. This is one area on which we are working in a big way. And there's an international NGO called World Animal Protection. For last 4 years, how to rescue animals in disasters and save their lives, because Sendai framework has also acknowledged that animal issue is linked to livelihood and sustainable development goal. So we have done a lot of capacity building. Bihar has been very receptive on that. NDRF has trained. So with the World Animal Protection. So whichever credible NGO, they want to tie up with the Center for Disaster Management and capacity building in PPF, will be very happy and join hands to take it forward. Other agency, I can't say how do we go ahead. Thank you.
Right. Thank you so much, sir. I think while I think we still need to find a way to institutionalize this kind of a collaboration, but we got some very good examples like how for working by putting in the heart of it, the people affected by the road accidents and the big migrant influx we are seeing the post-COVID. I think there's also a rise in the number of migrant workers themselves, dying in the accidents during this movement. I think there are organizations which have developed the analysis for that. And thanks for bringing that also to the highlighting that. I think maybe through COVID Academy and other initiatives, we need to think about these. I think at this also is, our heart and mind is going as the cyclone is approaching, to the people who are already battling the, the impact of COVID on their lives and livelihoods and other things. And now on top of cyclone. So we are seeing the people with disabilities, people, coming from the marginalized communities already facing the exclusion and other issues. So with all these complex vulnerabilities into place, they are girls and women, they are the pregnant women, the mothers, lactating mothers, and all these keeping all the vulnerable groups in mind. So my rest, although the time is running out, probably we would have dealt with this more in detail, but I would request maybe a one-line response from each of the panelists. So what is your one recommendation for these cyclone preparedness in this COVID context, keeping the vulnerable groups in mind? Over to you. Firstly, maybe Mr. Alok Ghosh, over to you for this. Just one top line recommendation for vulnerable groups, keeping cyclone preparedness for COVID context in mind. Over to you, Mr. Alok Ghosh. So you may be mute.
Yes, I think now it is audible. So my recommendation is earlier also we have experienced in any disaster, the disaster management group is only responsible to manage the cyclone shelter and other things. But now the situation is like this, the COVID-19. So my recommendation is not in paper but in practice. In each and every shelter, the it it should be ensured to maintain the COVID-19 protocol in all respect, and for that, the health department and all the line department should be available in each and every shelters.
Yeah, thank you so much. I think you made a very important point, Alokda. Mr. Mitra, what's your one-line recommendation, keeping the vulnerable groups in mind in this cyclone preparedness in COVID context?
Recently, it is conducting training for different sectors in the context of DRR. But it is a very small initiative. So this type of training program must be conducted at least at district level and block level. With different social sectors in the perspective of the
Yeah, so
the sector. Pardon?
yeah, I got your point, Mr. Mitra. Your voice is
Actually,
yeah, we understand. Maybe also cyclone impact is there now. We are losing your voice, but I do got your point that we need to do more such training programs, perhaps more such discussions at district and sub-district level. Definitely, we have a plan in vernacular languages at a state level, and the partnership is working out for that. What's your recommendation, Abba? Again, vulnerable groups, cyclone preparedness in COVID context. Over to you, Abba.
The first, if you really look at the response, COVID response, specifically in terms of food security, wash, and livelihood preparedness, there was a lot of things which the governments, respective central and state governments, have done, and also the civil society have taken care. But unfortunately, with this cyclone coming in, whatever material, relief material has been given, or what was thought of as a immediate livelihood response, may not be the right one. So maybe we need to revisit what has been done. If the material, food materials, and the materials which were given to the most vulnerable people is safe for consumption, because again the food security would become an issue for them, because they have already been given three, let's say in Orissa, they have already been given 3 months of additional PDS material, and the central government had given them the additional. That was all lying in the homes of these people. But
Yeah.
with this cyclone, it's lost. So we really need to think of, and I think one more thing which would be very, very important is the social distancing and the health aspects. We need, maybe there's certain need to have camps and other things with there.
Yeah, thank you so much, Abba. I think Mr. Alok Ghose would be leaving in a minute or so, but before he leaves, I take up one of the participant question through chat box with him, which is rightly connecting with what Abba you have shared. So Alokda, when people are being evacuated, are there any briefing to them on the best practices to be adopted inside the shelters? And are there any preparedness regarding their food supplies and wash in uh, the relief shelters? Is a question from one of the participants. Can you quickly address this, Lokda, before you leave the panel for your queries on the cyclone emergings? Yeah.
Yeah, thank you. This is a very good question and pertinent question. Actually, what happened, we have started the campaign or aware the people last 3 to 4 years, and now what is happening, the in COVID-19 do's and don'ts, and so many the the posters, IC material as developed by the Ministry of Family Welfare, and it is printed, and we are giving awareness to the people what need to do, what you should not do. It is already given to the people.
So you have adapted it to the COVID realities. Reality, I think there are earlier IEC materials required to be adapted to COVID. Is it done for the people in the shelters?
Yeah.
It's
So
done.
it is already some of the shelters in South 20 Pargana. I have the picture how they are pasting in the wall. What you should do's and don'ts.
Do's and
So yeah, do's and don'ts.
that's great.
So messages is continually message is spreading to the victims.
Yes. Well, this is my moment to thank you so much, Alokdaf. I know you are the most busy man with Cyclone almost nearby, and there were a lot of queries coming from a lot of places. Still, you took out time to be with us here.
Yeah, thank
We'll
you.
continue with the other panelists, some of the participant questions. But thanks, my moment to thanks you. Thank you so much.
Everybody.
I'll continue with now Dr. Vivek. Sir, what's your one recommendation for the looking at the vulnerable groups in this cyclone and COVID context? Over to you, Dr. Vivek.
So I
Brief.
would say through the IAGs, the civil society group can help, first of all, to identify the vulnerable group in each area. And I will give the specific example that I still remember. 1,965 pregnant women were evacuated before Cyclone Fani in Orissa. So that's the kind of precision we had in terms of identifying who are the vulnerable, the pregnant women, children, people, elderly with pre-existing diseases. And let's remember, people may be in quarantine or in isolation also, because 1 million population, 2 states in this will have many of those. So first and foremost, identifying who are the vulnerable. And the second is making sure the intent is always there, but we know that government needs this support of ensuring that what are the needs on the front lines in these shelter homes need to be communicated. For example, the example that we used, where if there was sufficient food for 50 more people, the exclusion would not have been there. So this kind of information, whether the vulnerable have been identified, tracked, and connected to the relevant services available to them. So that is the most important thing, and making sure that we bridge this gap as civil society to be the link between the community and the state, to make sure that people receive all that has been allocated for them.
Great. Thank you so much, Vivek, sir. And that was very, very specific. I think kind of an intervention have happened in the past, probably something same, looking at the people with disability. I'll go to Singh, sir. Sir, what's your one-line recommendation for the vulnerable groups in COVID context? Over to you, sir. Though we have already heard from you about animals, the issues related to animals and the others. Still, what's your recommendation, sir?
No, you asked for one liner. The fact is that despite so much of campaign by the government, violation of social distancing norms and all continues in a massive way. So my one line recommendation would be a continued, well-structured, massive community awareness program regarding do's and don'ts for COVID-19 with a special reference to high-risk groups.
Yeah. Great, sir. Thank you so much. And while that's happening is, I had a next question from the chat box, which is again talking about the vulnerability that among this population, at least 2% population have this is a people with disabilities. Among them are the visual and hearing impairment challenge. So how the warning and other measures, how the accessibility of information is being planned for them is the question from one of the participants. And it's also saying that my request is to take up this challenge with the NDMA and NDRF, and also how the NDRF probably is looking at this challenge of the accessibility of information to hearing and visually impaired people, sir. So do you want to say something on this, Singh, sir?
I couldn't get your, actually there was voice break. I couldn't get it. Can you repeat the question?
So the question is, it's coming from a chat box of our participants, that among the population who are in any population, there is at least 2% of people who are with hearing and visual impairment, right? So how is our information and guideline and information reaching out to them, that they also have access to information and able to participate with the drills and do's and don'ts? And the question have been specifically asked with regard to NDRF also. How is NDRF doing that?
It's a very, very valid question. And let me tell you, this issue has not been addressed so far. And I think NDRF and NDMA has to think afresh how to address this group. So at the moment, I don't think I can answer, because this has this needs a lot of brainstorming how to go about the whole thing. But very valid thing.
Thanks, sir. I think NDMA is recently trying to work on these guidelines on disability inclusive DRR. That's I think I'm participating in it. Vivek, sir, do you want to say something on this?
So, this is a very important area, and let me also go back and check with our DRR section, as you've said, that what are we doing with regards to our engagement with the NDMA and SDMAs. But just to tell everyone that now UNICEF, at least for the recognized NGOs that work with that specially abled group, we have intensified our efforts, and so much so that now all our business cards are supposed to have Braille at the back. So we cannot have normal business cards now. We need to have Braille printed business cards also for UNICEF for this inclusivity. So specifically for COVID response also, through a child protection section especially, we are working with these groups. But how far they are integrated in the NDRF, NDMA, this is one question where we would be very happy, and I'll look at that, because with the NDMA through Sphere, WHO and UNICEF were also involved in the development of the guidelines for NDRF's orientation on COVID. So even if that is not there, we must get this included.
Yeah, I think I would like to answer maybe on behalf of COVID Academy, and especially with the help of my colleague Astha and our partner, the Humanity Inclusion or the Handicap International. The COVID Academy programs, we are trying to make it as accessible as possible. The fonts and the website has a feature of accessibility for people with hearing and visual impairment. And also in many sessions, we are having a sign language interpreter to make it more accessible. I think we also need to strive to do it more. I think we will do that. So these are some of the things we have done at the COVID Academy, but I think we still need to go a lot ahead. I think I'll take a next question again is from participants.
Can I just say one?
Sorry,
Yeah.
Abha. Yeah,
okay. No problem. Yeah, I just wanted to let everybody know, all the press briefing which is happening in government of Orissa, at least sign language is being used. So that is one thing which is happening. And there are special sessions also which is happening for the institutions. Now, normally in the villages that I have no knowledge, I'll have to get it. But special efforts were made in the institutionalized PWDs. And sign language is part and parcel of any briefing by any government officer in Orissa during this whole COVID period.
Yeah, great. But I think the question is very pertinent, and I think I use the opportunity to advocate that we all need to do more and on this front to be really more inclusive. I think the next question is also from the chat box. Astha has shared with me. One of the participants is asking that quarantine centers, the Cyclone shelters are being used as quarantine centers also in many places in Odisha. So how is it going to impact the cyclone preparedness and where we may be needing more shelter in case there's cyclones? And further in view of this, how the sanitization of these places, shelter houses, of the vehicles and social distancing and is being being done? So that's a question probably, I think, to you, Abha. Can you please guide us through this?
Yeah. Many of the wherever the cyclone shelters have been used as COVID quarantine centers, in many places they are being shifted also, or else they are still being used. There are other places like these schools which have not been used, they have been prepared as a cyclone shelters. So the government has been very, very careful to ensure that both COVID centers, if it is not used, then it can still be used as cyclone shelter. If it is in use, there are people in there, then some other shelter is made to shift the people. Now, in terms of water wash activities or sanitization, that is something which has been very, very clearly mentioned in each of the guidelines which has been shared with the collectors and other people, and it is also a part of the press release also, so anybody can see it. Now, anybody, all the government officers and the agencies, civil society agencies, are also briefed about it. There will be still be certain lacunas which we can always do it. It would be very good if that is brought to our notice, and the government is willing to act on it immediately also. So maybe we can keep on giving that feedback to the government.
Great, great. Thank you so much, Abha. I think we'll take few questions direct from participant. I see one, Miss Dr. Vinay Kumar Sharma, want to ask something. I'm unmuting you, Dr. Sharma. Please ask your question.
वही गया, वैद गया, इन देशों में गया. अब इन
Please
देशों में
be,
अलग अलग
please
तरह
be very specific. Dr. Sharma, please be specific with your question. Yeah.
प्रोफेशनल्स हैं, बहुत लंबे समय तक रहने वाले लोग हैं. एक बड़ा वर्ग वहीं अपनी नागरिकता ले चुका है. वहां भी लोकतंत्र है, बड़े अच्छे नियम कानून है, जिंदगी है. वो बहुत लौटने वाले नहीं है, लेकिन उसमें से जो वर्ग लौटेगा वो हाईली स्किल्ड है, प्रोफेशनल्स हैं, उनको पता है कि क्या क्या है, यानी वैल्यू एडिशन के साथ लौट रहे हैं, एंड दे आर कैपेबल इनफ, यानी उनके पास हाथ में कुछ रकम भी होगी और स्किल भी होगी. वो आएंगे तो निश्चित तौर पर अभी जिस तरह से दुनिया की कंपनियां आ रही हैं, दुनिया के लोग आ रहे हैं, और भारत सरकार, खास करके उत्तर प्रदेश सरकार और सभी सरकारें वो कोशिश कर रही हैं, वो उसमें बड़ी आसानी से वैल्यू एडिशन करेंगे.
Dr. Vinay, will you be specific about your question? We have less time. Request to be specific. But please ask your question.
जो मजदूर है, जो कुछ काम कर रहा था, जो दुबई में शेखों के यहाँ काम कर रहा था, उसकी बड़ी बड़ी फैक्ट्रीज में लोअर लेवल पर काम कर रहा था, या ऐसे जो भी देश में बहुत नीचे के लोग, वो आएंगे तो उनको कैसे एडजस्ट करना है, ये एक बड़ी समस्या और बड़ा असंतुलन होगा. जैसे केरल जैसे राज्य में ये बड़ा.
Okay, thank you. I think his question is more concerned with the NRI returnees and how the state and the states are arranging for it. For the, I think his question is more pertaining to Kerala. Probably is not very relevant with this discussion. Still, anybody would like to address among the panelists?
Yeah, Vikrant, I would like to say something on this.
Yes,
not for the NRIs, but for the migrant labor. So at least Abha can add a few more lines. What I read through all the daily research work is that Odisha is training people who are migrant returnees in camps, and also identifying some of them who are willing to work at an honorarium of 150 rupees per day as frontline COVID functionaries in different areas. So at least this has been identified in some states, of especially for the returning the migrants who are being put in these quarantine shelters. And some of them have been skilled through the skilling campaigns, and they have been also put in the COVID response. That's a very pertinent question of the different groups of people who will be available, who would have returned to their natives.
Right. Thanks, Vivek. That's one thing which the Ganjam collector has done. And but besides that, also what the government of Orissa has now thought of is also they are mapping the skill sets of the migrants. MG Narega work is already started. So any migrant who even does not have a job card can come and register and start working also as soon as the job card is given. So the migrant mapping is going to happen. Skill set migrant mapping is happening. In UP, it has already started. Last I think 3-4 days ago, it is called Pravasi Rahat Mitra app. So which is where you are telling the government where what my skill set is, and subsequently they will work out a mechanism to engage with them with the MSMEs, SMEs, and also with the government work which is going on. So at least in these two states, this is how it is happening, I know of.
Great, thank you so much. And I think we are close to the end of this session, and it's my moment to thank everybody, to thank the participants, who have been there very patiently hearing and supporting us, and more importantly, for all the good work they have been doing on the front lines, in the COVID response and preparedness, and also now with the cyclone preparedness in COVID context. Thanks all of you. And my moment to thank also our eminent panelist, Shri KM Singh, Dr. Vivek, Abha, Shri Himadri Mitra, and Mr. Alok Ghosh. Thanks for all of you for taking out your time out of your busy schedules. I think, and also the mind is going towards now the development of the cyclone. So I take it a moment to take a break from this and hand it over back to my colleague Astha for final closure and any announcements you would have. Over to you, Astha.
Thank you, Vikrant. Thank you, everyone.
Thank you, everyone.
Thank you.
Bye-bye.
Thank you.
Thanks, everyone. Thanks, Vikrant, for handing it back to me. Just to close the session, I would also like to extend my thanks to all the panelists, to Vikrant for moderating, and for the participants to ask such nice questions that led to even more engaging discussions. So thank you, everyone. Let me now just close with the announcement of our next session, for which just give me a brief second while I share my screen. Yes, there we go. So for everyone who is a participant here today, please note that you will receive your certificate of participation. But to receive it, you have to visit our website, which is www.sphereindiacovid19academy.org. Please go to the website, find this course. Next to this course, there will be a button which says certificate. You have to click the button, enter the details that is asked of you, and then you will be able to download your certificate. But please note that it will take us about 24 hours to get all of your data uploaded to the website. So please check in after that time. So we're looking at Thursday this time, tomorrow. Our next session is tomorrow evening at 4:30 p.m. It's on essential and sick newborn care and early childhood development during COVID-19. So it's a very interesting session. We'll be hearing some voices from the field to talk about this. So please be there. We will send you the emails with more information shortly this evening. Lastly, if you have any comments for us, questions, feedback, please feel free to mail us at covid19academy@sphereindia.org.in, and we'll try and get back to you as soon as possible. So thank you, everyone. Thank you for being here with us. Thank you, panelists. I'm sure it's time for you to get started, not get started, but continue the preparation of the upcoming cyclone. So thank you, everyone, for being here, and we'll see you tomorrow. Goodbye.
Thank you.
Thank you. Goodbye.
And thanks to you, Astha, and the team.
Thanks, Vikrant. Goodbye, everyone. I'm ending the meeting now. Thank you.
Thank you.
Thanks,
Thank
Mr.
you, Vikrant. Thank you, Astha. Thank you, everyone. Thank you.
Ciao.